effectiveness for flu vaccine, it's one of those things where people keep throwing darts at flu vaccine for that. They say, it's not effective, it's not effective. And you kind of touched on this. I think, can be really effective when we have a perfect match and we're doing well with that. It can also be really not effective if you've got this variation, right? But it doesn't mean, as in general, flu vaccine is not effective. Because even in seasons where the match is not poor, the data has very conclusively shown us it prompts enough of an immune response in our bodies that even with the mismatch, it reduces hospitalizations, and it reduces time lost from work, reduces attended medical visits, and I would also say it improves your quality of life.
Welcome to the Pharmacy Quality Solutions Quality Corner Show, where quality measurement leads to better patient outcomes. This show will be your go-to source for all things related to quality improvement and medication use in healthcare. We will hit on trending health topics as they relate to performance measurements and find common ground for payers and practitioners. We will discuss how the Equip platform can help you with your performance goals. We will also make sure to keep you up to date on pharmacy quality news. Please note that the topics discussed are based on the information available at the date and time of recording. Information or guidelines are updated periodically, and we will always recommend that our listeners research and review any guidelines that are newly published. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. Welcome back to the PQS podcast, where we focus on medication use, quality improvement, and how we can utilize pharmacists to improve patient health outcomes. I'm your host, Nick Dorich, and on today's episode, we are continuing our series on immunizations. Today's episode is especially relevant as we are talking about flu immunizations. By the time you hear this episode, the vaccine for the 2021-2022 flu season should already be distributed to pharmacies and other healthcare providers nationwide. Pharmacists in some states, as we covered in an early episode, that means pharmacy technicians may already be providing immunizations and putting flu shots into arms. Now, with that being said, this is going to be a unique flu season, as many pharmacists could be receiving questions from patients about flu and COVID. Is the flu season going to be worse this year? What should the flu vaccine protect against? How does the flu vaccine and COVID vaccine interact? And well, we're hoping to cover those questions and maybe more in today's episode. With this episode, we are pleased to introduce a new guest to the PQS show. I've previously had the opportunity to meet and work with this guest, and I can confirm he's an absolute expert regarding immunizations, especially for flu, and that he's also a big proponent of pharmacists. So without further ado, please allow me to introduce LJ Tan, Chief Strategy Officer at the Immunization Action Coalition, to the show. LJ, it's good to have you here.
Hey, Nick, pleasure to be here talking about one of my favorite things to talk about, which is obviously pharmacists and influenza. So thank you for the invitation to participate.
Absolutely. Now, LJ, before we talk about the upcoming flu season, or the flu season that's already began, maybe, we need to hear about you. What's your background with healthcare? What do you do in your current role now?
Yeah, so I'm currently the Chief Strategy Officer, but soon to be the Chief Policy and Partnerships Officer at the Immunization Action Coalition. Change in title, not necessarily a change in role. I've been there for almost 8 years now. And before that, I was the Director for Medicine and Public Health at the American Medical Association, where I actually led their public health and infectious disease portfolio, which obviously they've covered influenza and immunizations. At the IAC, I do all the policy work on flu and other vaccine-preventable diseases. So I'm delighted to be here. This is going to be fun.
Absolutely will be. And LJ, thank you for the introduction. Now let's get ready for today's questions and let's hear the breakdown.
Now it's time for the breakdown. As Quality Corner show host, Nick will ask 3 main topic questions. Our guests will have a chance to respond, and there will be some discussion to summarize the key points. This process will repeat for the second and third questions, which will wrap up the primary content for this recording. After that, expect to end on a closing summary, usually containing a bonus question. Now that we have described the process, let's jump into the questions.
Pharmacist Letter is offering CE credit for this podcast. Please log into your Pharmacist Letter account and look for the title of this podcast and the list of available CE courses. I'm Nick Dorich, and our guest today is Dr. LJ Tan from the Immunization Action Coalition. For the purposes of disclosure, with this podcast, neither of us has anything to disclose. LJ, I would like for us to start talking about recent flu activity. We can't really do that without talking, however, about last year's flu season. So the 2020-2021 flu season, pretty unique, large impact because of COVID. What did we see for vaccination rates, and what did we learn?
Yeah, so the numbers are preliminary because CDC obviously has not published those numbers yet. But the numbers that we're hearing from our partners, for example, our manufacturing partners, is that our immunization coverage rates probably went up between 5 and 10% from the previous season. We're obviously delighted to hear that. I don't know if you all remember when CDC started, HHS and CDC launched this goal. I hate numerical goals, but they put one out there. 200 million doses given. I don't think we quite got there. But I think we came pretty close, and I think that's a dramatic improvement over our typical. The season before we administered about 165 to 170 million doses. A lot of it in pharmacies. So thank you all out there for that hard work. And so I think that as a result led to some of the impact we saw in influenza, which I think something I can kind of talk about really here, because when you're talking about how was the last season like, well, what season? Right? I mean, we virtually saw very little. I mean, we saw so little flu last season. So partly it's because I wish I could say it was because of the immunization rates increase, but we know it's not all that, right? We know it's because as a country we locked down, we did social distancing, we did masking, and all of that led to declines in transmission possibilities for the virus, and so we saw very little flu. This, coupled with what was going on overseas, resulted in the same thing, right? So it has to come in from somewhere. And if other countries overseas are not seeing a lot of influenza, there's not a lot of transmission into the country that's possible as well. So I think all those factors kind of played a role into the fact that last season we saw very little flu, and what flu we did see, I think we saw we saw some H1N1 activity, which is one of the strains of flu that we vaccinate against. But I think that's going to be interesting for us as we go forward when we look at data. Because one of the things everyone wants to know is so how effective was the vaccine last year? Well, it was pretty darn effective, but you know what? Our sample size was really, really small. And when you have really small sample size, it's hard to have a lot of confidence in some of the effectiveness numbers that we have. So I think last season is one of those seasons where we'll probably file it away, under the COVID impact season, and recognize that it's highly unlikely that we're going to see a season like this upcoming flu season.
Now, LJ, I do have a question, or maybe a two-part question. Flu rates or flu immunizations were up last year. Some of the disease burden we saw, that was down. So does that include specifically decreased hospitalizations and economic impact as well for employers, for groups as it relates to flu activity? I have to imagine that there's downstream effects because of that, correct?
Yeah, absolutely. I don't think you have to go with the anecdote here, right? Obviously, our entire season last season was looking at the economic impact of COVID-19 on the hospitals, right? The hospitalizations for COVID, all of that. And so I think, I don't think there was a lot of effort to tease out what we did indeed reduce because of the fact that we had so little flu. It's unfortunate because it would be wonderful if we could get those numbers, because it would help us really show that if we eliminate flu, we'll save the U.S. healthcare system a ton of money. Not just morbidity and mortality. I always start with talking about morbidity and mortality, about how much morbidity and mortality we would reduce if we could successfully immunize most of our population against flu. But for those who don't believe in that, the hard-hearted folks in us, who say, hey, I want more than that, I can tell you, if we could reduce that cost, that if we improve our vaccination coverage rates, that cost burden will go down. There's some studies that show that flu, can cost us every year anything between $6 to $10 billion. It depends on which study you look at. A lot of money that we could save.
Yeah, absolutely. I've noticed that myself with conversation, whether it be flu, whether it be COVID. It's not just death and hospitalizations, but it's also other disease burden that may come of it. Time away from work. There's other impact, taking kids out of school, et cetera, from that standpoint. So getting higher immunization rates is a big plus. The other follow-up question I wanted to note, LJ, you mentioned different countries, and flu's coming from somewhere, right? So for us in the northern hemisphere, I've typically understood it as flu vaccine that's being developed. It's typically being based on what strains of flu are being seen in countries in the southern hemisphere, and then that kind of works as a cycle, right? What ends up happening here in the northern hemisphere, that ends up impacting flu vaccine that may be available with countries in the southern hemisphere. Have I heard that correctly? Can you give us any other insight into how that kind of works?
Yeah, so I think if you look at the data, it's still kind of up in the air. I mean, there's some folks who say, yeah, absolutely. What circulated in the southern hemisphere the previous season for them, remember their flu season is our summer, tends to be what we see in our current flu season. I don't necessarily buy into that. I think a friend of mine, Dr. Bill Schaff, likes to say, when you see one flu season, you've seen one flu season. I mean, there are some trends you can argue, but it's risky to say what we saw in the southern hemisphere in terms of strains, for example, or severity is going to be exactly what we see in the northern hemisphere. I would not count on that. That being said, there is a lot of surveillance that goes on around the world for flu strains and what's happening, and it is based on that surveillance that we make our predictions about what will circulate in the fall for us in the northern hemisphere, and that's how we determine what strains we end up putting in the vaccine that, as you've mentioned, is beginning to flow out to the pharmacists right now. So I think that's one of those things that we will just keep. We keep doing this every year. We are pretty darn good at predicting strains, but as you know, there are seasons where we predict the strain, and lo and behold, after we started the whole manufacturing process, that darn thing moves on us, and we've got a season where we've got protection against two of the strains, but not against another two or something like that. And that's when we see the effectiveness drops.
All right.
Actually, Nick, if I could jump in there and just
please go ahead.
This is one of those things I think we've got a great educated audience here with the pharmacists. And I think this is one of the things I want to kind of point out, effectiveness for flu vaccine. It's one of those things where people keep throwing darts at flu vaccine for that. They say, it's not effective. It's not effective. And you kind of touched on this. I think, can be really effective when we have a perfect match, when we're doing well with that. It can also be really not effective if you've got this variation, right? But it doesn't mean, as in general, flu vaccine is not effective. Because even in seasons where the match is not poor, the data has very conclusively shown us it prompts enough of an immune response in our bodies that even with the mismatch, it reduces hospitalizations, and it reduces time lost from work, reduces attended medical visits, and I would also say it improves your quality of life. Because you're no longer, especially if you're 65 and older. I like to say, if there's someone who's 65 and older, sometimes you talk to them, right? They say, LJ, I've had a full life. It's not about whether it's going to take me out. It's about whether it's going to make it such that I can no longer cook my own dinner. I love getting on that shuttle from my assisted living facility and going to Walgreens or CVS and do my little shopping down there. I still want to do that. And I think my point is that if you get the flu and you're not vaccinated, you will be probably deprived from some of those, because of the fact that if you walk into a hospital unvaccinated with influenza, 3 weeks later, you might come out with a walker.
Yeah, LJ, I've had a conversation with a acquaintance of mine, and who has been lacking in vaccine confidence and the safety and efficacy. And I brought it up to them in a similar way, where it was, the vaccine isn't going to be perfect. It may not be perfect, but you have to think of it like it's giving your body practice. And we know Allen Iverson was not a big fan of practice, but for the body, it is a good example of, hey, we do need to have that. You need to give your immune system a way to read and react to something that it's facing as an external threat, so that when the real thing does come, its ability to defend against it is that much better. So LJ, I do want to move us on to our second question, although we could have continued there, I think, forever. But when it comes to immunizations in general, we've traditionally seen hesitancy to vaccines. Again, I prefer to address it as vaccine confidence, being a little bit more positive. And this has been a hot topic of late, because it's something that's been difficult to manage for flu vaccine for each and every year. Now, you mentioned with your role and in the organization, there's policy components that come into this. So from your perspective, I'd like for us to explore what policies and what changes can be made to improve flu vaccination rates each year and going forward. Policy and those processes are good, but there's also very much a human element that we need to take into consideration. So I'd love to hear your thoughts on this topic.
So maybe what we should think about is to flip it a little bit and figure out what the human elements are first, and then make our policy to address those human elements, right? So if you think about general public, right? I think the number one reason a lot of people tell me they don't get the flu vaccine. It used to be it was going to give me the flu. Now the big one is that it doesn't work, and I think we need to address those. I think so in terms of trying to educate our public about the fact that actually flu vaccine doesn't give you the flu, and here's why. There are many things I say to that. One of the big things I say to that is this idea that if flu vaccine actually gave you the flu, and we vaccinated 170 million people last year, we would have had 170 million cases of flu. But we had no flu. So flu vaccine does not give you the flu. First thing, right? So we need to not just throw them facts, but show them, hey, why it can't, it's inactivated, it's dead, it's a piece of the protein, all those things that we talk about. We need to also simplify to what I just said. Look, come on, just use some logic, right? If flu vaccine gave you the flu, we would have had 170 million cases of flu last year, which we did not. So one thing. Then the other thing that I hear a lot of is it doesn't work. And this is where I think this is some of the policy changes we need to start thinking about. We need to stop being so driven by effectiveness numbers in terms of disease prevented. So if you think about vaccine effectiveness and you think about that 50%, 40%, 30% that we always hear tossed about for flu, and people hear, wow, 30%. And then they go, wait, COVID, that was 94 to start with, right? I mean, they say, well, flu vaccine doesn't work. But the truth of the matter is that's about preventing infection with influenza. And as we've already discussed, sure, it's not the perfect vaccine against preventing primary infection with influenza, but heck, it does a darn good job to prevent mortality, to prevent hospitalizations, and to prevent time lost at work, and to improve quality of life, especially for those over 65. And then for those with chronic heart conditions, those with chronic illnesses that are predisposed to severe complications if they catch influenza, it will save their lives as well. If we want to think beyond, we need to think about policy that doesn't just address this issue of primary effectiveness against disease prevention. We need to think about policy that will actually encourage our providers, encourage our media people to recognize the benefits of flu vaccination beyond just infection. We need to talk about time lost in work. We need to talk about quality of life. And that's what we need to start doing with our folks, I think.
What role do you see for healthcare providers? And because we're the Pharmacy Quality Corner show, I'll ask specifically pharmacists, like how do pharmacists need to address this differently? And I'm just thinking about my experience. This time of year, and then for the next couple months, I'll see signs, I'll see advertisements on the radio, I'll hear commercials when I'm listening to podcasts about, hey, come and get your flu shot at your pharmacy. But it's always focused at this point in time. And part of my thinking process is that this needs to become a normal communication with patients, even in February or March, because at that point, the flu season from that year is winding down. And there's some information as to whether or not getting a flu shot at that time is particularly useful or effective, again, because flu season is winding down. But from my standpoint, it could be useful not for February or March, but 6 months later that you're laying the groundwork. So LJ, I'd be interested to hear your thoughts on this. Is this something that pharmacists we need to be doing in our pharmacies? Is this something that we need to be doing as local community leaders, with public health leaders, or with public officials, et cetera? I'd be interested to hear your thoughts.
I love that idea, right? I mean, this is something that I think it's about the community. Firstly, just to that's a little misconception there, Nick. Just want to say, more than half of our, to look historically, more than half of the peak of our flu seasons happen in February. So I would argue, absolutely, we should still be vaccinating in February, and let's keep doing it, right? So because I think it will still save lives, and it will still save some mortality, morbidity down the road as well. But I think you're right. I think this is the idea of how we, some of the things we've talked about, actually, I apologize. We didn't talk about it. I just had a media interview before, so I apologize. But some of the things that I think we do with pediatrics is that we have socially normalized vaccination. I mean, if and people say, no, there's hesitancy. Well, absolutely. But you know what? If you take a look at our numbers, especially in the 24 months of age and younger children, those kids don't have school entry requirements, right? Those kids are not yet eligible for entry requirements into school, and yet the coverage rates in that population of kids is over 90%, which strongly shows us that it is still the social norm to immunize in our children. What you're suggesting is that we need to do that for flu vaccine, and you're right. The way we can do that is to leverage your pharmacists, right? Because you guys interact throughout the year with patients, especially patients who are high risk, patients with diabetes, patients who are obese, pregnant women, because they're coming in to fill prescriptions, patients with chronic heart disease. Your pharmacists see these patients. And boy, every time they fill their meds, if you just mention in April, hey, it's April, I know you got your flu vaccine already for this season, but guess what? Come September, be ready. We're going to be offering it again to you. We want you to get it. So you're right. If we keep mentioning, even when it's not yet flu season, and remind people over and over again that it is the social norm for flu season for you to get the flu vaccine, I think it will really, really help. I think that's something we have to really work on. And I think one of the other things for pharmacists that I think, I love you guys, but man, you guys have to be more aggressive. I think you should be doing this. You should be looking at patient records and saying, if you got a person with diabetes in front of you, push the recommendation. Don't let the patient say, hey, is it time for my flu shot yet? You need your flu shot now. I'm ready to give it to you. Can I give it to you? I think you guys are moving there. COVID has really changed a lot of the environment, but I really want pharmacists to be leading that charge and saying, I see you, you're due, let's get you vaccinated. And I think that's the way, I think we can get these numbers up again.
Yeah. LJ, as you were explaining your answer, I was thinking about this, and it sounds a lot like, to me, you may be familiar, there's 7 steps to creating a new habit, or that's a frequent idiom that's used for it, or a 2190 rule for creating new habits, where essentially you could do something straight for 21 straight days, and then it's a 3-month, can you stick with it? And as I think about it with flu, it's kind of this, you get bombarded for this couple of months in the fall, but then that's it. There's no continuity that's there for it. So it's almost like any efforts that we're taking each and every flu season, we're having to restart them the next flu season, whereas a better process would be having more of a continuous conversation with patients about the importance of it. And LJ, I could not agree with you more around immunizations, pharmacists, and I'll say as well, because for many pharmacists, many pharmacies, there's other healthcare providers that we may be working with, or we may be working with colleagues in a health clinic that's, attached with the pharmacy. Many pharmacists have good relationship with their local prescribers as well. And this is definitely an item where it should be a process that we're all bought into, not just for flu. We're talking flu and COVID today, but there's other parts, other immunizations that can be routine. So for patients that are coming up for, hey, you coming up for a tetanus booster? Are you coming up for, Hep B immunization? There's so many others that are there. So LJ, I'll let you respond. I don't know if you've got anything else to add to this one.
You know what? I've always been pushing this idea, and I wish more people I wish we could figure a way to make this happen. I think based on your collaborative statement there, I think it'd be awesome is if a patient comes in and gets a flu shot at a pharmacist, the pharmacist follows up immediately and says something like, okay, I've given you a flu shot. Before you go, do you have a primary healthcare provider? You don't. Well, because you're 52, you're due for a colonoscopy. And if you've not had one, can I recommend a local physician or clinician that you should go see? And talk about building those networks, right? If we could do that, because there's always been, and we always know there's some tension among pharmacists giving vaccines, and the clinicians going, you're taking away some of my patients. And I think if we collaborate and talk about that immunization neighborhood, and if that part means also the pharmacist saying, hey, I've given you your flu shot, but you might be due for a colonoscopy. Dr. Jones down the street is taking patients. You should go check that out. Make sure, especially if you don't have a primary care provider, you need to check up on those things. I think that will close a lot of those gaps. And I think that's a great way to kind of keep improving that immunization neighborhood.
Yeah, absolutely. LJ, we'll move to our third question on that note, and we have to further address flu vaccine, COVID vaccine. At this time last year, there was the very popular phrase about a quote unquote twindemic. Now, I'll ask the question for you. Did a twindemic happen? I think you already addressed that a little bit based on, low flu activity last year. But does that mean we're out of the woods yet? And there's many countries around the world where there is still a severe lack of access to the COVID vaccine. And we're seeing a lot right now on the Delta variant. I'm hearing more about other potential variants that are, popping up as well. So as we are starting to get into a new flu season, what do healthcare providers, what do we need to be prepared to address? What questions do we need to be thinking about? And what other information should we be paying attention to as we approach the fall and winter months?
Well, as we go forward, realizing that a lot of those mass immunization COVID-19 clinics are beginning to slow down, in fact, disappear. In fact, most of them are already gone, right? You guys, the pharmacists, are the ones, along with the clinicians, are the ones that are going to be offering COVID-19 vaccines going forward. I think there's an opportunity to not just offer COVID-19 vaccine, but also to say, hey, guess what? You got your COVID-19 vaccine, but you're not done yet. You got flu. Flip it. Someone comes in for flu. If they haven't had COVID-19, the pharmacist would say, hey, thank you for getting the flu vaccine, but you're not done yet. You still got COVID-19. And we would love to be able to give that to you as well. Because I think the pandemic is, and I know some of my colleagues don't like the fact that I use that word, but I like it because it's snazzy and people will remember it. And that's, for me, more important. And I think, it's one of those things where I think you keep it in the top of mind, right? So I think the pandemic is going to be a real possibility this fall. And the reason for that is we're not sheltering in place this fall. I think, I caught strep throat last week from a Boy Scout camp that I was with my son. And RSV rates, respiratory syncytial virus rates are shooting up right now. I think all these respiratory pathogens are coming back. And the reason they're coming back, and some of them are coming back earlier, RSV, everyone's saying, hey, this is a little early. The reason is because we're no longer masking the way we used to. We're no longer probably doing hand infection control the way we used to. We are no longer social distancing the way we used to, creating this opportunity for these respiratory pathogens to come back. And as they come back, who am I to say flu is not coming back? It's coming back. And so it's all the more reason that we have you all as pharmacists out there really telling folks, flu vaccine, you got to get it this fall. And at the same time, after you got your flu vaccine, can I get you COVID as well?
Yeah. And LJ, as I'm thinking about this, one question I meant to ask in our first question with flu vaccine, because previously, and at least I know when I was going through pharmacy school, you had a trivalent flu vaccine that was there. What's the flu vaccine look like? I mean, is it predominantly quadrivalent now that we're seeing? Are there any other recommendations around high dose flu for older adults? Because I think these are important questions as well. Does that make a difference, trivalent versus quad versus high dose for patients with COVID? These are the things where, for me as a pharmacist, I can go and look at some resources. My grandparents or family friends, they're not going to have that kind of access to that information. So do you have any other recommendations that pharmacists should be thinking about when it comes to those common questions that they'll get from patients?
Yeah, so absolutely. The majority of the vaccines out there, in fact, are quadrivalent. The whole industry has moved towards the 4 strains. So that's great. So that trivalent, quadrivalent debate is going to just disappear. Okay, with regards to the different, it's really funny. We came from a time back in the early 2000s where we didn't have enough flu vaccine. I don't know if you remember the crisis of capacity. And we've come to a point now where we've got so many flu vaccines, but also so many different types of flu vaccines. And so as your providers, your pharmacists have to really figure out what's going on. The rule of thumb is from the ACIP is it's better to immunize than not to immunize. So as a result, there is no preferential recommendation to use one product over another product if you have a product that is recommended and eligible, appropriate for the patient you have in front of you. So in other words, if you've got someone who is 68 years of age and you don't have high dose or you don't have adjuvanted flu vaccine, don't tell the patient, I want to get that in stock and then vaccinate you. No. The ACIP says, take the standard flu vaccine you have and vaccinate that patient, because it is so much more important to make sure the patient gets some protection than to get protection from a vaccine that potentially could be a little bit more effective. So I think that's what the ACIP says. That being said, I do want to point out that there is at least 4 studies out there right now with regards to the high dose vaccine that shows that about a 24 to 25% superiority in terms of effectiveness over the standard dose vaccine. However, I want to reiterate as I say that the ACIP makes no preferential recommendation.
Understood. Well, LJ, thank you for that additional information and for clarifications that's on there. Just kind of being a smart aleck with this, we've got quadrivalent flu vaccine. When are we getting a flu vaccine that has 5 strains for protection? Is that, I assume that's the next thing on the pipeline, right?
I think it is, and I think there's some manufacturers out there now with COVID-19 experience with the mRNA technology, with some of the nano particle technology, the virus-like particle technology that are looking at their effectiveness against COVID and going, flu. And indeed, at least one of those manufacturers who reported very good success with cross-reaction to variants is indeed a flu vaccine manufacturer. And obviously, I will not mention the name of a manufacturer in the podcast. But I think I'm optimistic that a lot of this knowledge that we're gaining from our COVID-19 vaccination technology experience is going to translate to a point where we may have a more universal flu vaccine. And when we say that, it's not going to be something that you give one dose and it's going to last for 10 years, but it may be something where we can give one dose and there's enough cross-reactivity with drifts that we're going to be able to last for 2-3 years, right? So I think those are things that we're looking for. Those are things we have to look forward to as we go down the road.
Yeah, I'll use a kind of a metaphor that's here and having over the summer gone to the Kennedy Space Center and just seeing how such a monumental event like going to the moon, how that changed technology and impact for what we do in just so many ways. Something like COVID-19 and some of the, with as you had said, the mRNA, it's different. And it makes us think differently about it. It's a technology that we had. It was a development that we had. It hadn't really been applied, though, right? And I think that's a key point. People say it's been an experimental item. That's not true. It hadn't been applied to real world, but it's not an experimental process in that way. So I'm really interested, just as you are. The science nerd in me is incredibly curious as to what manufacturers and developers are going to be doing in this way, seeing the application of this. So I think that's a very interesting item. And I think while COVID-19 obviously has been a very down subject for many obvious reasons, there's always positive items that we can gain from this and how we push public health, how we push medication use going forward, including other better immunization. So I think there are positives there that we'll see in the future going forward.
I'm going to just jump in, Nick, and talk about the improvements, right? Because of COVID-19, pharmacists are all now in the immunization information system. And
that's a good thing.
That's huge. You know how huge that is? Because now pharmacists can look up and decide, get and identify gaps in their patients as to whether they need other vaccines. And the hope is going forward, pharmacists will become even more active in offering vaccines to their adult patients, saying, oh, wait, you need Tdap. Oh, wait, you're actually 44 years old. Do you want to consider HPV? I mean, all those things can now become possible because pharmacists are in the IIS, the Immunization Information Systems. And so I'm hoping that your pharmacist colleagues will now grab that and say, look at all the things I can do now for in the immunization neighborhood.
Well, LJ, I'm making a note here that call to action may be a topic for another podcast in the not so distant future for us, and we may have to have you back on too to help us explore that one. But with that, I will wrap up our content for today's episode and our primary questions on the upcoming flu season, impact from COVID-19. LJ, again, thank you very much for your insight. You're obviously coming from a wealth of expertise working with this day in, day out. And as you said, it's been an amazing transformation as pharmacists have been able to shift being one of the healthcare providers, and I would add pharmacists, but also pharmacy technicians are now also playing a role in this. And we've got more of a role as community leaders to help advocate for immunizations and other public health efforts that will really help to reduce the spread, whether it's of flu, whether it's COVID, or any other disease states that we can help reduce by immunizations. Now, LJ, we are reaching the part of the podcast where we like to discuss something fun or unique with our guests. I had an item in here, and I still may have you address it, but I'm going to pivot just a little bit. We are a quality improvement podcast, so I'd like to ask you actually, a year and a half of largely being at home and being socially distanced, have you worked on any new skills? Have you further developed any skills? Are there any improvements that you've had that you would like to share with the audience?
I'm a Zoom expert. And my mantra, how every year there's a mantra for the year that reflects the year. My mantra is, you're on mute.
I have to say one thing, as going back into the real world, there's some times where you would like to have a mute button that you can click, and you miss having that from the Zoom experience. But LJ, that's a great one. Glad to hear you've had some positive with that. The other question I would like to ask you, and that I did have in our script, was you obviously, as we've stated, you've been a big advocate for pharmacists and for more involvement with immunizations, but even more broadly. So would like to hear from you. Do you have any shout outs? Are there anyone or anything particular in pharmacy that you think is really something else to recognize?
I think it's time to recognize, and it's not this individual wonderful community pharmacist sitting out there, but it's a gentleman that I've been friends with for many, many years, and that's Mitch Rothholz. Mitch Rothholz from the American Pharmacists Association has been one of the stalwarts in championing pharmacists' immunization. And the nature of this idea of the immunization neighborhood, where we all collaborate as healthcare providers around the patient to get the patient vaccinated. So I think where pharmacists are with their immunization efforts today is in no small part due to the tremendous work that Mitch Rothholz put in earlier in a decade ago. So I want to call out Mitch and thank him not only for that, but also thank him for being a really, really good friend. And Mitch, looking forward to talking to you personally, or not through a podcast. One more thing I'm going to say here to your pharmacists. Flu vaccine, for all that we talk about, may be 30, 40, 50% effective. But if it stays outside the arms of patients, it's 0% effective.
Yeah. Great final point there, LJ. And we'll make sure Mitch hears your note there as well. I'm sure he'll appreciate that. Final question for you today, LJ. If folks have questions for you about flu, about COVID, immunizations, what they can do around public policy, et cetera, what's the best way to contact you?
Oh boy, you guys are so important. Just email me directly, lj.tan, T-A-N, @immunize.org.
Excellent. Well, LJ, that does wrap up our episode. I thank you very much for joining today. Really great conversation. We have a couple different call to actions that you provided for us. So I've got notes for follow-up, future episodes, things that we can promote for pharmacy. So I really love having that. Again, appreciate you joining for today, the information, appreciate the shout outs, and appreciate your longtime support for pharmacy as well. Now, thank you. For our listeners, make sure you subscribe to our podcast. And if you have a question or topic, please let us know. Similarly, if you have a topic that you would like to come on the show and talk about, we would love to hear about that. You can DM us directly on Twitter @PharmacyQuality or email us at info@pharmacyquality.com. With that, I appreciate you, the listening audience of the Quality Corner Show, and there is one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.